Northern Uganda was recovering from 20 years of civil war, one of Africa's longest conflicts. In 2009, a group of professionals from Kansas City traveled there to assess the need for health care and education. They were met with great interest and received an invitation to bring medical, surgical, and nursing teams. Their mission? To promote cultural sensitivity and global awareness while providing nursing education through a service learning model. This is their story of how it began and the work that they are continuing to do.
I retired about 9 or 10 years ago. My wife kicked me out of the kitchen and out of the house and said, go find something to keep yourself busy. And I had met the Johnson County nursing students at Shawnee Mission, where I practiced for 25 years. I also ran into an old friend from University of Pittsburgh, where I interned, who was on the faculty of the School of Nursing.
Back in, I believe it was 2009, we were approached by Dr. David Zamorowski, and Dave is the benefactor who was really behind the installation of the Simulation Healthcare Center. He helped fund that. He funded the college's first endowed chair position, which is kind of the supervisory capacity for that facility over there. And so Dave's got a very rich history of being a part of that program, and he's also been a benefactor to Las Pintas as well. So Dave comes to us, and he has an interest in Uganda.
Came to Johnson County and actually to these other institutions in the city and said, I'd like to volunteer. I don't need a salary. How can I help? People were looking for a meaningful service project, and I found myself connected to Northern Uganda.
His closest buddy is the head Jesuit in Uganda. Okay. And so Dave is very involved there in helping them build a new high school in the northern part of Uganda, which is the Gulu region. And Dave thought it would be a good idea to go see the high school, but also to take a team of people from Johnson County Community College, as well as representatives from the University of Kansas and William Jewell, and an organization called Medical Missions, to go to Uganda and kind of do a site check to see what opportunities are there for not only medical missions, but also our various nursing programs and international programs from these other universities. So it was quite the trip.
We wanted to involve the largest medical mission group in this region, Medical Mission Foundation, and see if we couldn't get them to promote a long-term arrangement with education and healthcare development, and felt that by involving the nursing side of this, we had a much better chance of influencing infrastructure. So we deliberately got nursing faculty that were interested in this from William Jewell, from KU, and those two faculty people came, a representative at medical director level from Medical Missions came, and the rest of the group were all from Johnson County Community College. Myself, Joe Sopcich, Kathy Carver, Mary Smith, and Stuart Beal.
So the initial trip allowed for some nurses. We had a photo faculty from Johnson County Community College. We had an administrator. We had a representative from a medical missions group. We had other faculty from the area. And here we all bonded and went over to actually go and be introduced. And it's very important, you know, to let them in, you know, welcome you properly. It's very important that you just don't come and just shake hands and move on. You sit down, you talk, you have something to eat, and you have something to drink, and you really get to know each other. So that whole initial trip was just life-changing, I think, in many ways, because all of a sudden our doors then were just opened in Uganda.
We were hosted by Ronald Reagan Okumu, the Honorable Ronald Reagan Okumu, and his beautiful wife, Jane. And they were incredible hosts because they're the ones who were able to open up all kinds of doors.
My role in supporting education and healthcare became unconditional. When I became a leader, I just found myself there.
And so with the Honorable Reagan, who's a member of Parliament there, he did have some leverage. And so we were able to visit all kinds of different medical facilities, orphanages. We visited clinics that were out in the bush. We visited facilities that were more in kind of the urban areas, all looking for opportunities of what our students could do. And at the end of the trip, we were able to sit down and they were able to come up with some incredible ideas. And now Mary Smith is leading the initiatives where we take students over there. They're working with and training folks with regard to various aspects of medical care.
And with the goal always in mind for us in nursing to see if it was a place that we could share with our nursing students in an attempt to raise their awareness of global health needs, global awareness, and in addition to help them to become more culturally sensitive and competent. And we found an amazing place to share with them at Lacho Hospital in Gulu, Northern Uganda.
We actually went back with a medical missions group. We went 6 months later and actually went in and served. We went as part of the surgical team. And we went to Lacho and we were able to work very long hours doing nursing care that I hadn't done for a long time. But it just, we were allowed to be able to work directly with that group.
And we participated with the School of Nursing there. And it is a kind of a hospital-based program. It reminded me of probably similar to what healthcare would have been like maybe 100 years ago in the United States, and they do a very functional model of care. Something that was very different there, though, is that the nurses, there's very few of them to many, many patients. And so they're dependent on families also participating in the care of the patient. As a matter of fact, when a patient comes, they have to bring an attendant to be able to prepare meals for them, to do their hygiene needs and take care of their physical care. And the nurses then focus on passing medications, doing some assessments, and caring for the patient, helping the physician.
From that moment, we said we made more friends. We were able to have more introductions into the hospital, into the School of Nursing, and I felt very at home. I had students from Lacho Nursing School working with me right at that time when we were taking care of the patients after surgery.
And what the role that we played primarily last year with the nursing students and the faculty was to help them in the classroom. We did a variety of lectures, content on maternal child, pediatrics, and mental health.
We bring a tremendous amount of equipment and medication that allows surgeries they would never be able to do with their resources.
We took over a program called Helping Babies Breathe. And there were these small mannequins that we took down along with a kit to be able to resuscitate and breathe for a baby within the first minute of life, called the Golden Minute. And then we went and we took several of the kits with us and taught the nursing students and about 80 nursing students and 3 faculty in how to implement Helping Babies Breathe. It's a train-the-trainer program, so you want to teach them and then they need to teach it.
The medical professionals in Uganda can perform procedures for those that can come to the hospitals, but many cannot afford the services. The Honorable Ronald Reagan Akumu has made it his mission to ensure that all of the children of Northern Uganda receive adequate medical attention.
I suddenly arrived at some homestead. I found they were burying a young kid. I asked them whether that kid had died of Ebola. They said, no. I said, then why didn't you take the kid to hospital? Say, you know what, we took the kid to Lacho Hospital. The kid got admitted, but we escaped. I said, why did you escape? Say, we didn't have money to pay, because Lacho asked for some money. I said, no, this is unacceptable. I went to Lacho. I asked them, how much is admission for young children? The medical superintendent told me it's equivalent of $1. So I actually wept. I say, how can $1 make a child die?
This would be a very incredible experience for our students.
And our doctors and their doctors work side by side
to enhance their education while they're enhancing ours at the same time.
It was one of those trips that you'll never ever forget.